Well, Hannah, that's an excellent question, but we see private healthcare as being very defensive. There still exist a number of challenges within the public healthcare sector, and as such, we don't see that as a viable alternative for existing medical aid members. So we see the private sector as remaining pretty resilient, despite the fact that the overall economy is taking strain. And people tend to get sick, unfortunately, irrespective of the vicissitudes of the economy. We've also got a lot of new capacity coming on stream, some 6.1% increase in capacity, some 584 beds and 2 new hospitals. And we expect increased demand for those services. We have plans in primary care and some of our other divisions as well. Very, very much so. It's part of our core competency, and without trying to sound immodest, we have over the last 17 years developed a public-private partnership model. We now run the largest public-private partnership in Lesotho, where we are exclusively treating public patients, more than 350,000 a year. In the United Kingdom, more than 40% of our patients are NHS funded. They come directly from the public sector. And we'd love to be in a partnership with government, either through our existing facilities or through a new NHI dispensation, where we're able to treat public patients. We do hope that there's going to be a degree of pragmatism, and that pragmatism will override some of the underlying ideology or views on the private sector, because we do think that austerity will breed that pragmatism, and that we can find ourselves in that sacrifice of common purpose between the public and the private sector, and that we'll be able to meaningfully contribute to NHI. It needs that solution in our country. I think the sustainability of healthcare provision in South Africa is threatened by the lack of skills and the shortage of nurses and paramedics and doctors. Certainly in terms of nurses and paramedics, we run the largest training program in the country. This year, we've trained just under 4,000 nurses and paramedics. That's testimony to our commitment to skills development and trying to sustain healthcare provision. But truthfully, all of us need to do a lot more in that regard. Hannah, I'm going to make an uncomfortable answer to that, because we as Netcare don't believe in healthcare tourism. It's one thing doing the initial operation and doing that well, but who's ultimately responsible for the follow-up of that patient when they return to their country? And so you can have a perfect hip operation done in this country, but are you overburdening healthcare resources in the country of origin by sending that patient back if there is a complication? If you operate on a young child with a cardiac condition, who's ultimately looking after those patients? So we're focused on the long-term care of patients. We see it as our responsibility once they've been in our facilities, and so we're not promoters of healthcare tourism, certainly in emergency cases, and we see an enormous amount of emergencies from Africa coming through. Of course, that's life-threatening, but for elective surgery, we tend to stay away from that. Well, we continue to scour the international market. In this past year, we've looked at 3 opportunities that we've walked away from. We do believe, and I don't want to sound immodest, that we do have the IP and the DNA to transfer a lot of that offshore. And when the right opportunity presents, we'll certainly make that move. In terms of our own war chest, you can see how undergeared our balance sheet is at the moment. And so, we'll be very considered in terms of a potential acquisition offshore.